Welcome back. Pfizer's COVID-19 vaccine could be available for kids ages 5 to 11 by Thanksgiving. That's if the FDA signs off on the biotech firm's request for emergency use authorization. It's a move that could help protect more than 28 million people in the U.S. Joining us now is Dr. Stephen McDonald, emergency medicine physician here in New York City. And Doctor, thanks for taking some time out. So tell us, what would getting these younger kids vaccinated mean in our fight against COVID-19?
Absolutely. First of all, thank you for having me. We should start off the conversation saying that of children 18 and younger in the United States, there's been about 500 deaths. And of this 5 to 11-year-old age group, there's been about 125 deaths. Those numbers are very small when you compare them to deaths in people over 80, over 70, et cetera. But no parent wants to have a child that's one of those 125. And so, the closer we can get that number to zero, the better. And this vaccine seems to be a good way to do that.
I want to shift gears a little bit. There have been proposals, or not proposals. We do have, in fact, vaccination deadlines for healthcare workers across the country that have come and gone in many areas. And especially since you have boots on the ground here in New York, I'm wondering what it's like. Are you seeing people comply with this? Reports I'm reading are that most people, in fact, the overwhelming majority, are in fact vaccinated. Not many people losing their jobs over this.
Yeah, so, vaccine mandates are proving to work. Many people are hesitant, and we're seeing that no amount of coaxing from the medical community, from friends, from family has been persuasive enough to get people vaccinated. It's really the pressure of a mandate that actually nudges people over that line. And so we're seeing real success stories. Companies like United Airlines or Northwell Health in New York State have been able to get upwards of 90%, sometimes 99% of their workplaces vaccinated. It's an incredible win for vaccines.
Doctor, I want to get back to this kids vaccine for a minute, because a lot of parents out there are concerned. They're saying this has not gone through rigorous testing. At least that's their belief. They think that the amount of children that it's been tested on is too small and has not been going on for long enough to really be indicative of what the impact will be on children. What would you tell those parents who are concerned about the safety of their kids and the efficacy of this vaccine for those young children?
Absolutely. It's an excellent question. So one, I would encourage those parents to remember that children 12 and older have been able to get vaccinated. And so it really isn't too big of a stone's throw to extrapolate that to children ages 5 to 11. The other thing I would say is that I don't expect that vaccination in this age group will look the same as it does in adults. We're already seeing that children, especially young men, may have some cardiac side effects from the vaccine. And so I imagine the dosing will be smaller, and maybe even just one dose, though it's too early to say. The FDA has yet to weigh in on that.
Dr. Anthony Fauci yesterday was talking about the potential to mix booster shots with the original vaccine. So in other words, you get a Moderna, maybe a Pfizer booster. I'm wondering how the research is coming along in that arena and what people are finding.
So, it's a great question. Hopefully we'll have answers by Halloween, though some people are saying maybe in the next week or two even. The jury's still out on this. If I had to guess right now, I would say we're definitely heading in that direction. But I'm not leading any of these studies, so I'm not an insider.
Do you happen to know for if and when the vaccine is available for kids 5 to 11, will parents be able to get that for those children at their regular pediatrician's office, or where would these shots likely be available?
So I imagine the means of distribution will mirror that for adults. So if you remember, for adults, it was pretty difficult to get a vaccine in the beginning. And so the formulations of the pediatric vaccine are going to be different from the adult vaccine. I imagine we'll be seeing some bottlenecks early on, but that you should be able to eventually one day get it as readily available as you can the adult vaccine now.
Well, as we head into the fall here, it's flu season. I'm getting some notifications from my doctor about getting a regular flu shot. Any way that we can attempt to predict if there's going to be a fourth wave, at least in the U.S., of COVID? Are we seeing any other variants on the rise here? Any possible predictions for what's going to happen during this regular flu season with COVID?
It's a great question. what we see is that COVID tends to work in these 2-month cycles, and epidemiologists aren't really clear on why that is. We seem to be winding down our 2-month cycle of the Delta variant. It remains to be seen if we'll be starting up another cycle of another dangerous variant. I think the take-home message I can say is that the more people we have vaccinated, the less likely it is that new variants emerge.
I wanted to get your thoughts on this. There are indications that a small percentage of vaccinated people are developing what's called long-term COVID. And the Biden administration is saying, and that's a good argument for why we should expand the availability of boosters to more people who have gotten 2 doses of the vaccine. Can you explain for us what long-term COVID is, and when do you think we might see booster availability widen?
Sure. So I see a good amount of long-term or long-haul COVID in the emergency department, actually. It's typically in the form of people who had a COVID infection prior to vaccines becoming available. And then they come in with complaints that they basically don't feel like their old selves. They feel like their chest is constantly a little tight, or they always have some dull, low-grade chest pain. They feel that they can't exercise or climb as many stairs as they used to be able to climb comfortably before becoming short of breath. That's sort of the most typical manifestation that I personally have seen of this long-haul form of COVID or long-term form of COVID. There is some promising data, though, that those who are vaccinated are actually less likely to develop these long-haul symptoms than people who are unvaccinated. It's another reason to get vaccinated, aside from protecting yourself from death by COVID, is to also protect, even if you don't die, these sort of longer-term symptoms.
All right, Dr. Stephen McDonald, we're going to have to leave it there, but thanks so much for joining us today.